Today I am trying to cover the topic by name atrophic rhinitis. So this is one of the chronic diseases of the nose, paralysis, sinuses, and related areas. So in this, we will try to cover etiological aspects and pathogenesis and also clinical features. Later on, how to manage this case. Under this heading, we will discuss one by one. As per the definition, it is one of the chronic nasal diseases characterized by the progressive atrophy of the nasal mucosa and the underlying bone of turbinates. Thereby, thereby end result is you will get a roomy nasal cavities, and because of the roomy nasal cavities, and also the ciliary function gets affected. The improper function of the ciliary function affects the crust formation. Thereby, secondary infection can take place. Finally, it is going to give rise to foul smell from the individual noses. That is the presentation. Right? Now, under this, there are classification made as primary type and secondary type. Primary type means really we don't know the cause of it, and because of secondary means secondary to some other chronic disease like tuberculosis, leprosy, etc. Under the epidemiology, it is more common in Latin American races, yellow races, and American Negroes. It is predominantly seen in females than in males. Age group affected are is common in puberty and also young adults when compared to other people who are of old age population. Under the etiology, the exact cause of the primary type is really not known. I already mentioned earlier. Various theories have been put forth to explain this cause. Thereby, according to some authors, it is caused by following pathogenic organisms. It is being mentioned as Coccobacillus, Bacillus mucosus, Klebsiella ozine, Coccobacillus Vitidis ozine. And according to some other authors, the disease is caused by endocrine imbalance, particularly those of estrogens. Out of this, hereditary factors are blamed by some other authors. Some authorities advocate poor nutrition aspects with iron deficiency, poor nasal hygiene, and overcrowding as causative factors. Some authorities advocate autoimmunity against the nasal mucous membrane as a causative factor. Second rhinitis, I already mentioned you because of the chronic infections of the nose. Under that category, we can put forth as syphilis, leprosy, tuberculosis, and also chronic sinusitis. And because of this, excessive surgical dissection of the nasal mucosa or turbinates may also result secondary atrophic rhinitis. That means during crude handling of the nasal mucosa and also during total inferior turbinates or when we handle the nasal mucosa in a very crude way, the end result could be impairment of the ciliary mechanism, resulting in crusting, thereby secondary infection. It may give rise to this sort of secondary atrophic rhinitis, secondary to your surgical managements, which are to be delicately handled. If you are aggressive, if you do excessive damage, ultimate maybe your atrophic rhinitis. Under the pathology heading, it is in the initial stage the blood vessels of the submucosal areas develop endarteritis and periarteritis. This is one of the factors which will result in your atrophic rhinitis. This leads to decreased blood flow to the nasal mucosa. As a result, the nasal mucosa will become atrophic. There will be metaplasia of the ciliary columnar epithelium to cuboidal or squamous epithelium. Thus, the end result is inefficiency of the mucociliary mechanism. Thus, the loss of cilia in the nasal mucosa will lead to pent-up of thick secretions in the nose with secondary bacterial infection because of bacterial proliferation. The secretions will get dried up in course of time and form crusts, which will exit or emit characteristic foul odor. It is called ozina. Atrophic has been labeled as ozina is another term has been given to it. The endarteritis and periarteritis are also cause atrophy of the bone in the turbinates, making them very thin. The end result is roomy nasal cavities. Under the clinical features and symptomatology, the following are the common complaints which the patient may approach the clinician. The nasal obstruction, bleeding from the nose, anosmia, foul odor or fetor emanating from the patient. Patient doesn't feel the odor, others feel the foul smell, hence the anosmia in otherwise called as a merciful anosmia. The patient who suffers will not have the appreciation of the foul smell. The people who are close by will experience and they feel that they cannot sit beside the patient. This is the merciful anosmia is really fits to this condition, whereby the patient will not suffer, the people will feel the foul smell. Bad smell coming from the patient may lead to social boycott of the patient. So patient may have the psychological distress. We have seen some patients gone to the level of divorce and later on after proper treatment and counseling, they could come back. So this will lead to psychological distress. What are the signs and symptoms? Under the signs on examination, I already mentioned, it will be atrophy resulting roominess of the nasal cavity. Turbinates also become thin and atrophy. The end result is passage will be roomy, and sometimes you can even see by doing your antirhinoscopy, the posterior pharyngeal wall appears like a curtain when the patient swallows. So that means so much roomy, you can straight away see the posterior pharyngeal wall. In this, nasal mucosa will be found to be covered with crust, which may be green or yellow or black. Removal of the crust will lead to bleeding. That is the reason for the epistaxis. So these are the few endoscopic pictures. Thereby you can see in the first one A, you can straight away see the choana. Later on you can see the posterior pharyngeal wall. Same thing with number 2, that is B, that is left nasal cavity. A is right nasal cavity. Straight away you can see the posterior pharyngeal wall, which is really not possible in common individuals with normal noses. So these are the some other clinical findings. You could see green or yellowish color crust totally occupying the nasal passage. So that will lead to obstruction of the nose. That's why this is one of the complaints is nasal obstruction. Also, in addition to the other complaint, other symptoms. So this is the one thing. This is nothing but a pulled out crust, which is being shown here. They are nothing but a dried up crust. Later on, patient will come out with some sort of when he clears the nose, you may see some crust to fall, or when I do nasal irrigations, it will be detached. And later on, patient may feel little comfortable, relieving the obstruction element. What are the investigations we need to do? So in this routine hematological examination to rule out the iron deficiency anemia, which has been mentioned under nutritional cause. Estimation of the serum iron levels is also an important investigation. And serological tests for syphilis, X-ray of paranasal sinuses, and CT scan of nose and sinuses to rule out the associated chronic sinusitis is also to be done. So this is a classical X-ray image of an individual. You are able to see associated chronic sinusitis in addition to the roomy nasal cavity, and you can see even the maxillary sinuses are also atrophied. This is one of the common presentation. This is the secondary to chronic sinusitis. The end result is pathogenesis. What is the treatment available? One is medical treatment. Under the medical treatment, the symptoms need to be improved. The foul smell of the nasal crust can be softened and cleaned by the other methods like washing of the nasal cavity with alkaline solutions. It is prepared with sodium carbonate, sodium bicarbonate, sodium borate, and also sodium chloride. And it is to be taken in a sort of bottle, whereby you can irrigate the nasal cavity, whereby crust will get detached, and thereby patient will get a moisture feeling. An application of the cotton pledgets soaked in 25% glucose in the nose after the irrigation usually recommended. They also inhibit the growth of the causative organs. because the glucose is the one which is hygroscopic, which will maintain moisture, which in turn is a hostile environment to the causative bacteria. That is, explanation has been given. Otherwise, they call it as a 20% glucose in glycerin tampons to be kept in nose. Thereby, we are inhibiting the growth of the causative organisms which are having saprophytic nature. The disease process can be inhibited by installation of the anti-vaginal drops, which are containing chloramphenicol and estradiol dipropionate and vitamin D and poly, propylene glycol, and it is available as a some sort of chemicity in nasal drops. I don't know whether it is available now, but it used to be used. Later on, intranasal submucosal injection of the human placental extracts has been tried. Some authors advocate rifampicin 600 milligrams once a day for about 12 weeks. That means 3 months. If the patient is suffering from anemia and malnutrition, they must be also be treated. And there is surgical element. Surgical treatment is also available. So it all depends on the situation. Many surgical treatments have been recommended, but yet it is unsatisfactory to treat the condition. That's why the field is quite open, wide open. Anybody can start doing their work in a sort of research. They can come out with a suitable solution. The field is quite open. We used to ask our postgraduates to take up this sort of challenge. Roominess of the nasal cavities can be reduced by intranasal submucosal injection of the paraffin, and also roominess of the nasal cavity can be reduced by medialization of the lateral wall of the nose by some surgical implantation of Teflon strips and polyethylene strips and also cartilage beads under mucoperiostem of the lateral wall. But instead of doing all this, there is being noted that alkaline phosphorus levels are found to be high. Any amount of this sort of attempts are not found to be satisfactory. This is nothing but a narrowing procedures of the nasal cavity. Other measures are implantation of the same material under mucoperichondrium of nasal septum and mucoperiostem of the floor of the nose also reduce the size of the nasal cavity. Some people even mention porcelain pellets can be inserted. The complete closure of the nasal cavities are also being recommended, and it is being mentioned as a Young's operation. Thereby, after closing the nasal cavity by taking the flaps of the skin at the vestibular area, the mucosa likely to get regenerated and normal epithelium can be achieved. Later on, this operation was being modified by making a small hole in the center of the diaphragm like, and it is being mentioned as a modified Young. And in the entity of secondary rhinitis, the underlying cause must be treated. And in addition to this, there is something called biogenic stimulators. Earlier, we used to implant the placental bits taken from your obstetrics department. We used to put in penicillin solution, and a piece of the your placenta will be implanted in the floor of the nasal cavity. Thereby, it will be acting like a source of estrogen. So, but the greatness is it won't get rejected. That is the peculiar of the placental bit or pieces. It has been tried, of course, initial 1 or 2 days. There may be upper lip edema, but it is acceptable because it is a rich source of estrogen. And in addition to that, there are some granulomatous conditions can give rise to this sort of things of heterogeneity. Out of that, one is tuberculosis of the nose, and tuberculosis infection is very commonly seen in India. So sometimes you have to rule out the possibility of tuberculosis as secondary cause. So tuberculosis infection in the nose usually affects the cartilage septum, but it was also reported to be lateral wall also can involve. It may occur either as a primary lesion and also as secondary lesion secondary to pulmonary or area as primary focus. They occur secondary to primary tuberculosis, pulmonary tuberculosis. The disease may occur either nodular lesion or ulcerative lesion. The symptoms are pain in the nose, nasal discharge, and also nasal obstruction. On examination, you could see bright red nodule may be seen on the cartilage septum. So the tuberculosis affects the cartilage is one of the noticeable difference when compared to syphilis and also the your leprosy. It may break down in course of time into the ulcerative lesion with the undermined edges. This is one of the characteristic features of the tuberculous lesion. Undermined edges and lividity. That means blue pigmentation will be mentioned, will be seen actually, and it will ultimately result septal perforations. Thereby, this is one of the common cause for septal perforation is tuberculosis. And you need to go for a bacteriological examination of the nasal discharge. It may show tuberculous bacilli, and you can have a complete characteristic features of the bacilli in tuberculosis. This is otherwise called as AFB, acid fast bacillus, and it must be distinguished from leprosy. So biopsy from the lesion will show typical granulomatous reaction of tuberculosis. Out of this, the characteristic cell is epithelioid cell, and it will have a lymphocytes and giant cells are also seen. It all depends on the gazeating or non-gazeating tuberculosis. The treatment involves brushing of the nasal cavity with alkaline solutions for the removal of the nasal crust as routine. The course of anti-tuberculosis treatment will cure the disease. This is the line of management. Thereby, primary disease has to be controlled, and thereby symptoms can be improved. So these are the few clinical photographs whereby you can see how the nose appears. It is just as a routine, but you have to look for the septal perforation, which is being seen here, whereby you can see the perforated septum and take a biopsy from the area, and you can see typical tuberculous characteristics in your histopathology examination. Confirm the diagnosis, treat the patient accordingly by medical, and thereby you can improve the symptoms by irrigation with saline, or if not, the sodium chloride, sodium bicarbonate, and sodium biborate. So this is the typical histopathology picture. You could see giant cells and also epithelioid cells and central caseation necrosis. The giant cells have been mentioned as a Langerhans giant cells. Peripheral place your nucleated bodies, and you can see this very characteristic you covered as Langerhans giant cells. This is the finding. Anti-rhinoscopy reveals thrusting of the nasal cavity, which has already been pointed out with red hair. Um, Next thing is how frequently we are getting these cases in our country. So this is one more thing. India is a poor country, already been mentioned. Now the nutrition, when compared to 30, 40 years, definitely the conditions have been improved and the nutritional aspect is improved. Earlier we used to see malnourished situations in children and also other people. Now because of that good improvement in our economic status, we are not finding much cases as in earlier days. But at the same time, the disease still present in poor socioeconomic countries or developing countries, especially has been mentioned in Nigeria, Kenya, and other places, because there still the undernutrition is prevalent, and also in the age group I mentioned just now, are still there. But secondary to tuberculosis, secondary to syphilis, secondary to leprosy, we are still finding the cases as primary cause being the gram-negative disease. Tuberculosis is present or prevalent in India, so definitely when it, and also chronic sinusitis. You have to look for the secondary cause I just mentioned above, or nothing is noticeable, then treated as a primary atrophic rhinitis. The underlying cause I already been mentioned there. That is the what about endarteritis and periarteritis is the pathology for leading to this situation. But still, the disease doesn't have any satisfactory, acceptable mode of treatment globally, but it can improve the symptoms and patient can have a good quality of the life, provided the all other contributing factors for these conditions need to be kept in mind, like improving the nutritional status, iron deficiency, and also lot of counseling and education of the individuals and their parents. Thereby, if children very difficult to manage.